Hey guys, this video you're about to see is of Dr. Pareek. He's my head oncologist. He's the man that's actually over the chemotherapy portion of my treatment plan. He's a chemotherapist, but just one member of the team. Anyway, here's a little bit about what he had to say when we met with him the other day on some of the stuff about my cancer, specifically around the chemotherapy. And he did his best to try to answer some of the questions my family and I had, but most of it, the questions we had, needed to go to Dr. Deb, which we will be trying to get answers to. So here's Dr. Pareek. Oh, I'm feeling ups and downs, man.
Okay.
As long as I don't eat and I take pain meds, I feel pretty good.
Okay.
To be honest, there's a lot of pain. When I eat, it
So
feels
why?
like I eat really sharp gravel
So why do you think that pain is there?
because I have a sore in my guts.
So what will take away that sore?
I guess a round of radiation, chemotherapy, and surgery
Mm-hmm.
to remove my esophagus and some of my stomach. Maybe all of my stomach.
I don't think it's all of the stomach. Dr. Deb will decide that.
Yeah.
I'm not a surgeon,
Right.
so.
You're
But
the
yeah,
chemo
definitely,
man.
definitely part of esophagus will be gone, and that's for sure.
Yeah. Wow. I'm going at this day by day. You know what I mean? I have the plan to move forward in the process. Uh, you know, it's a lot to consider having your esophagus and your stomach taken out. The quality of life. I have questions about things.
Shoot.
I'm diabetic. I talked to the nurse the other day,
Mm-hmm.
and she said, they kind of generalize and lump everybody kind of into
Mm-hmm.
one like 60% chance, or whatever, of surviving the surgery and all that business, or 70 or whatever. But
Surviving surgery is not ever. It cannot be a question. Surviving surgery is Dr. Deb's part.
Right.
My part is to tell you how people do with this treatment.
okay,
I cannot generalize to you. You are a single
Yeah.
person. I cannot make assumptions to you.
Right.
So let's talk about 100 Mr. Floyds. If 100 Mr. Floyds come to my office today
Mhm.
with your kind of cancer,
Right.
their 5-year survival, that means at the end of 5 years,
Mhm.
they will be alive. The chances of that are around 50%.
50.
Yes.
Okay.
So that means 50 of them will be done by that time, or all 50 of them, some people will be living more than that.
Right.
I do not know where you fit right now.
Right.
Your tumor is a little bit bigger. It has some lymph nodes involved in it. So it gives you on the poor scale. That means your tumor is a little bit more aggressive.
Right.
Surgery, surviving surgery depends on all your overall health,
Right.
overall morbidity, like overall other problems you have. Like if you have heart disease,
Mhm.
that's put you at higher
Yeah,
risk. If
sure.
you have diabetes, that put you a little bit higher risk.
Yes.
If you have hypertension, that puts you higher risk.
Yes.
If you're on a wheelchair, that puts you in a higher risk. If you're like not eating well, losing like weight, like 10 pounds every week, it puts you at higher risk. So, but when we do studies, we calculate these people, but we do not go by like, hey, how many people with diabetes lived? How many people with hypertension with them? Because
Right.
this is
Yeah.
all journalized.
Yeah.
We just make sure that everybody who came to us was walking, had a good performance status, was able to do things their own,
Right.
without any trouble with the tumor. So we lump them together, and we are lumping you together because you can do all those things together.
Okay. So on my oncology team,
Mhm.
it seems like you are like my actual, like, the leader of my team.
I'm the medical oncologist, yes.
Okay. So if I ask you, like, how long, let's say I'm in intensive care or the hospital after surgery for 2 weeks,
Mm-hmm.
will I be able to go home, or do I need to go into assisted living or nursing care, or what?
Usually people was doctor because once you're in ICU,
Yes.
because you're in ICU, hopefully you're in ICU after surgery,
Right. Yeah.
not
yeah.
during the chemotherapy, because that would be a complication.
Yeah. Right. Yeah.
Surgery is a planned ICU stay.
Yes.
So Dr. Deb's team decides how they gonna discharge patients.
Right.
Sometimes they discharge patient directly from ICU
Right.
directly to home. Sometimes they put patient to ICU for 1 week, then they downgrade them to a floor
Right.
where they can like less intensive care but still care, and then they send them home directly.
Well, what I'm interested in is, because I live alone,
Mm-hmm.
I want to know, am I going to be able to take a shower on my own at home at that time? Am I going to be able to go home,
This
or do I
question-
have to go to?
This is a question with Dr. Deb's team. I think there should be no problem taking shower or like.
Yeah.
The only complication you can have is sometimes people can have a tube for sometimes for a month or so. During that time, you can cover the tube and take showers.
Yeah.
I mean, there's no reason for not shopping from showers. But if Dr. Deb's team had a specific recommendation and he doesn't like his people to take shower, then I cannot answer that
Yeah,
question.
right. So what are we meeting for today then?
To discuss when are we going to start treatment.
Okay, well, when are we going to start treatment?
When you say, yes, I want to start, I'm ready for treatment, and you can go ahead with the procedures.
Yes, I'm ready to start the procedures.
So, so the process will involve me applying for insurance company to get drugs approved for you.
Yes.
Right. Once they approve it, then I can start putting orders in.
Yes.
Once they get approved, the infusion team will call you. The
Yes.
infusion team downstairs have like 50 chairs.
Right.
This is like an aeroplane. It grows every day.
Right.
So people will come in, walk in, get the seat, get the treatment.
Right.
I do not know when your seat is booked.
Right.
Once it is booked, you will be booked for every week.
Right.
You will come here every Monday, get the treatment. I'll see you every couple of weeks to make sure that you're not having side effects from the treatment.
Right.
And you will see radiation doctors.
Right.
Have you seen radiation
Yes.
doctors here? When did you saw them?
This morning.
This morning.
Yes.
So what did they say?
Waiting on you.
Waiting on me,
Yes.
and I'm waiting on you. Okay,
Yes.
that's fine.
I'm going to go until I decide not to go.
Okay.
That's it. That's
So
it.
as you have said to me today that you're going to start treatment,
Yes.
I'll put those orders in today. It will take at least a week to 2 weeks to get your treatment approved
Yes.
and get you onto a chair.
Yes.
You will need something called a port, P-O-R-T.
Port, yes.
Port. Yes.
He's familiar with those.
Yeah, so you will need one. So I'll ask Dr. Deb's team to put the port in.
Okay.
Either sometimes Dr. Deb puts it, or sometimes Dr. Rennersman, his partner, puts it.
Okay.
So I do not know when that's going to happen.
Okay.
But we need it before we start treatment.
Right.
I mean, usually we can start
So
treatment.
you're going to get a hold of him and schedule that?
I'll let Robin know.
Okay.
Robin.
Is the port going to be up here?
Yeah, it's going to be up here or this side, right side, or
Right.
left side. Usually we prefer the right side. But if you don't like right side, you can put on the left.
Okay. That's good, man.
Okay. Did
You
we
look,
give you?
you look kind of like discouraged or disgusted or something.
Do you have any idea, time-wise, when he will go through the surgery?
Mr. Floyd, so
she lives away and I live away, and I intend to be here.
this
with-
treatment
with us.
this treatment is a whole package of like around 3 to 4 months. That means he will need radiation and chemotherapy for about 6 weeks or so, 6 to 7 weeks, depending. We do not hit any like complications in between. That means the treatment goes on treatment as planned. We plan to give 6 to 7 cycles of treatment with radiation and chemotherapy. After that, he gets a month break, a 4 weeks break. So that gives you around 11 weeks time. After that, we'll do another scan to make sure that his tumor has not grown or not grown anywhere else, and whatever we did had a good response to it. And after that, Dr. Deb will take him to surgery. So we're already about 3 months before his surgery can be done.
So we're talking roughly up in February.
Somewhere
4
like
months, around
that.
4 months,
Yeah.
yes. I think
Good with
I
that.
expect his surgery to be done around first week of February or so.
Yeah.
But Dr. Deb's schedule has to match that. If he has too many patients or like 2 less patients, he can do it early or later, depending on his schedule.
Well, we're interested because his mother needs to know,
Mhm.
and I need to know.
Sure.
Yeah.
But I cannot give you correct answer because at this point of
Well, you're
time,
giving me a pretty close
yeah,
one.
yeah, because I do not know when we are going
He-
to start his treatment.
Yeah.
Suppose we start his treatment next week. That's like November 1st, right?
Right.
So 4 weeks, that'll be December 1st. Take 2 more weeks. So around December 20, he will finish all the treatments.
Yeah.
Then January 20th, we'll do another scan.
Right.
And then within the first week of February, we should be able to do the surgery. So that's around first week. He should be feeling all right by March 1st if everything goes according to the plan. By March 1st or something, because February surgery, 2 weeks of surgery.
Well, as long as he knows in advance, so he can let his
Yeah,
mother and
sure,
myself know.
Sure.
Yeah. I
So
will.
that we can make arrangements to be here
You
with
will.
him.
Yeah. Of course. We'll make sure that
And
happens.
he only gets chemo once a week?
Yes, chemo once a week, radiation every day.
Yeah.
Radiation will be every day, Monday to Friday.
Right.
You can decide with radiation people what time do you want to get radiation. If you live far off, I encourage them to take radiation around like 11 o'clock or something so they don't hit traffic.
Right.
And they're done, and when they go back, they don't hit traffic.
I
You
got
might-
it.
and
I
we'll-
got it worked out with
Yeah,
him.
and we'll do your blood test like once a week on every Monday when you come for treatments. What you can do is you can get your blood test done on a Friday, because Monday it will be really busy here. So Friday labs, you can do those labs on Friday morning, and or Friday afternoon before you leave, and Monday you can come and get treatment. Those labs will come to me, and I will decide whether you need to get treatment or not. Sometimes the chemotherapy can drop your blood counts, so I can make a decision. Don't give chemotherapy to Mr. Floyd this week, or delay it for 1 day, or delay it for 2 days. I'm confident it will work.
Okay. Good.
And will the chemotherapy, that'll help with the lymph nodes too?
Yes. The chemotherapy will help with the lymph nodes, and the radiation will also help with the lymph nodes.
I think they're planning on taking those
Yes,
malignant lymph
they will
nodes out.
They will clean out everything there. No, I expect a smooth ride. Your blood sugars can go up and down, and that will be for a few days once you get treatment, but I'll not be that much worried about it. Keep drinking a lot of fluids. The more water you drink, your sugars get controlled. And then chemotherapy goes in your system and comes out. The less water you drink, chemo stays in your system for a long time. You don't want chemotherapy to be in your system for a long time. You want chemotherapy to do its job and get out. It can only get out.
So what does it actually do?
What does it actually do? It goes to the cancer cells and kills it.
What do you mean? How does it do that? What is it?
So cancer cells have DNA in there, right? Our human cells have DNA in it. So some of them are DNA damaging agent, that's carboplatin. And the Taxol, which is a microtubule agent, that it means bind the DNA together and cells together. So it goes there and disrupts it. Cancer cells are not your regular cells. They have good backbone, but they are weak compared to the normal cell. So the chemotherapy kills them faster. But then chemotherapy gives toxicity to the normal cells also. Which we will see, but I don't expect it to be that much great. That's how it kills it.
Okay.
How much water should he drink a day?
As much as he can.
I drink plenty.
I mean, do not drink like gallons and gallons, but yeah, two and a half liters is fine.
As far as like diabetes, hypertension, those kinds of things, I know Dr. Cantu over at Family Medicine works with that. How will the chemo affect any of blood pressure?
Chemo will not affect. I mean, blood pressure. His blood pressure is 125/68 right now.
Sure, right.
I mean, I'm okay till 160s, 170s.
Okay.
Once in a while.
So just keep him following up.
He will be getting steroids on the day of the treatment, and those steroids can jump up his blood sugar. We will see how he does in the next couple of days. They can go up on his Lantus. For the Tuesday and Wednesday and Thursday. We'll go a little bit higher.
What is he getting? So will he get steroids every?
No, just only time, just every once a week. Yeah.
Okay, once a week. What?
So on that day, the sugars might be a little bit on the higher end.
What steroids is he gonna get?
Decadron.
Decadron. Okay.
We'll try to give him low dose, not like high dose dexamethasone.